My name is Henry Otoneru. I'm a cardiac sonographer here at Community Memorial Hospital.
Let's roll.
I'm a cardiac sonographer, so I do all the cardiac ultrasounds here, whether they're bedside or we actually run stress echoes in this room where we do an ultrasound of a patient's heart or get them exercising, or we also participate in transesophageal ultrasound where we pass an ultrasound camera down your esophagus and do cardiac imaging that way. That's just another modality that we use to take a look at the heart, and we do just make sure that when it comes to the heart, everything's in place doing what's supposed to be doing. Sometimes you're a cardiac ultrasound tech, you're a therapist, you're a shoulder to cry on. Sometimes we're furniture movers, you know, and but yeah, the main thing is just doing the best you can to make them feel welcomed. We have like definitely a family-oriented vibe here. Ventura County is a melting pot, which I love, and yeah, to be able to work here and you know, not only work for a cardiac hospital, but even specialize in cardiac here too is a true blessing. So I've been here a long time. I've grown with this place, and yeah, this place is definitely a home away from home for sure. We got a big structural heart day today, so a bunch of TAVR cases with Dr. Fatemi and Dr. Juan. Because of these physicians, we get to be a part of some of the new innovative stuff that we're doing here and able to provide for our community. For many years, we weren't doing that here. Sure, they were doing it more in like LA and those areas in the bigger cities, but the fact that those physicians were able to bring that here to our backyard, and now a lot of our community can stay home and get these procedures done is great.
So Henry is so fun. So he just such a professional. I mean, he's so good at what he does. The images that Henry's able to do, I mean, it's pretty phenomenal. He's top notch.
Don't try to hide. This is my boss, Rayanne. Look at it.
Good morning.
Hers all pretty, looking good.
For now.
Henry is an echo tech that I've actually known Henry for many years. I knew him when I was in the critical care unit. He's fun, he's hardworking, he's definitely dedicated to the hospital and to physiology.
So I asked them like for the most gangster lead that they had, and this is what they handed me. So Cath Lab to me is definitely my favorite. Patient comes in from the ER, and then let's say, you know, God forbid that, you know, they're having chest pain, or they need like, you know, possible stents, or, you know, doctors want to take them to the Cath Lab to go check their arteries, right? And we do other structural heart cases that I'm able to participate in, which are the TAVRs and the Watchmans. So to me, it's like to see patients come from the ER, have chest pain, go to the Cath Lab, get a tune-up, to see the transition from being scared and you know, having something significant going on with their heart to getting fixed, and all of a sudden they're sitting in their, you know, regular room and they're eating breakfast and they have family there and they're ready to go home. That's probably my favorite part. And what we do is we went ahead and deployed an aortic valve. We did an aortic valve replacement, but we actually went through the artery, came up into the heart, deployed the device. We'll keep the patient for a few hours. We'll do a follow-up ultrasound just to make sure like everything's cool and the patient's feeling good. And for the most part, patient will probably go home today, most likely. So, yeah, Dr. Fatemi and Dr. Juan, they knocked these cases out. We got 4 of those today, so we'll get it all done and taken care of for sure. Now, 17 years later, I'm still in the same career path, but 15 of those years I was able to stay here at Community Memorial.
Hi, this is Tina at Cath Lab. Can I speak to Brian?
Hi, I'm Tina Connell. I work in the Cath Lab at Community Memorial, and I've been here for about 10 months.
Texas Tina.
Texas Tina.
Texas Tina, or Tina from Texas, or Houston, or anything that I have several nicknames.
Texas Tina's great. She's like newer to the team, but just she's fit in so well. She's just a smart nurse, super strong nurse that very caring.
She's fun. She is definitely, when you think of Cath Lab personality, she's got a Cath Lab personality.
You have to be a good team member. You have to be willing to be part of a team, willing to learn, try new things, because Cath Lab is constantly growing. The technology that we have is not the same technology that we had 5 years ago. It's constantly reinventing itself. My time here at Community Memorial has been really, really good. The facility is amazing. The people are amazing. My coworkers are just, they go above and beyond every day. We help each other all get through the day.
Those are mine. That's my normal team, all three of them.
Cath Lab is where people come to have cardiac procedures like heart caths, pacemakers, EP studies, and interventional radiology type procedures. We're constantly doing new things, which is really good for the community because a lot of things that we're doing now, typically you would have had to go to Los Angeles, UCLA, or a much larger hospital to have them done. And now we're doing them right here in the community, which is good for everyone.
You dropped something.
I chose to become a nurse because my mother was a nurse, and I saw the joy and the fulfillment she got from being a nurse, and I was drawn to it.
Do you have any more questions, or?
We have a team of 4 people. It's a cardiovascular tech, a radiology tech, a nurse, and someone who scrubs. So all 4 of us together, we have our roles in the lab. My team's a blast. They're the sweetest guys you'll ever meet. We are together on call days for 10 hours, and if we have extra cases that run over into the evening, we're together for 12 hours sometimes.
We really care about each other. You can see it as where they're all involved in each other's lives. We all follow each other on social media, so I know about Greg's kids. You know, it's just a big family.
When we're doing TAVRs, we're working with OR, we're working with Henry and Echo. We have Dr. Juan and Dr. Fatemi and the anesthesiologist in the room. So we're coordinating care with different modalities.
It was very welcoming to me when I came here.
When I started here, it was in the midst of COVID, and a lot of times I hadn't even seen anybody's face. I just knew everybody by their eyes. Not only did we have to worry about our patients' health, we worried about our health too, and the health of our families. Well, that was a big concern for everybody. You know, it's a different time for us. It's really cool to see everybody, how they all help each other. All the physicians that I've interacted with are so good, and they're constantly, you know, just lifting up the nurses and the staff and teaching us new things. And it's just, there's a lot of appreciation for each other. The things that we're doing now in this lab were only done surgically a few years ago. So it's pretty amazing what's happening with the Watchmans, with the TAVRs. Everything that's happening here was not done, 10 years ago. It's because I came. No, just kidding.